boy, what a morning. Welcome back. Well, we know October is Breast Cancer Awareness Month. So beyond getting a mammogram, what else can you do to reduce your risk? We thought we'd ask Dr. Angela DeRosa. She's joining us this morning. Good morning. Always great to see you.
Likewise.
So this is a big month. There's a lot of people wearing pink in honor of breast cancer. Now, how can we reduce our risk?
Well, when you want to talk about how to reduce your risk, you got to look at what causes cancer in the first place. And when you start to think about that, it'll start to make a lot more sense. So what drives cancers is inflammation in the body. So think about it this way. If you have an irritating coworker that constantly annoys you and constantly rubbing against you, you're going to get mad and explode. So think of it that way. You have irritations in the body, inflammation, rubbing against cells, which causes an explosion and a mutation of that gene, and that's making that cell grow, and it gets out of hand.
So irritation, stress.
Inflammation, yep.
Okay, and we all carry these cells. We all carry these genes. It's more than just a genetic thing.
If you think about it, even skin's a perfect example. We're chronically growing that skin layer, but normally we take care of it and kind of black it down, bank it back down, and then it regrows and we kind of take it down. It's when we get growth that gets accelerated and out of control, that's a cancer. And when we think about inflammation, so think about the different types of cancer. Cervical cancer, it's the HPV virus that rubs against those cervical cells, causes a mutation, and we have cancer of the cervix. H. pylori, it's a bacteria that lives in our stomach that can cause duodenal ulcers, but also can lead to problems with Burkitt's lymphoma, which is an esophagitis type cancer.
Oh boy.
Talk about breast cancers, as we're specifically talking about breast cancer this month. That inflammation against a breast cancer cell. So if you're overweight, we take that estradiol, that good estrogen, convert it to estrone, which is a toxic estrogen in the breast cells, creates inflammation. Bam, you're now looking at potentially a cancer. So genetic mutations, so family history. Smoking creates inflammation. Being overweight creates inflammation. Actually, a risk factor for developing breast cancer, having a college education. So the stress associated with that potentially may be associated with inflammation that causes breast cancer.
And how many times do you hear, I'm sure when your patients come to you, but this doesn't run in my family. And you're probably like, okay, so what do you do for a living? You know, tell me about your life.
Stress.
And I'm sure you're probably like, ding, ding, ding.
Alcohol, smoking, stress, actually even vitamin deficiencies, hypothyroidism, having low estrogen is an inflammatory state, which is contraindicated. A lot of people think estrogens are contraindicated, but the good estrogens are good for the breast.
Okay, example of good estrogens.
Estradiol, 17-beta estradiol. Our ovaries make 17-beta estradiol. That is a good estrogen. But estrone, again, in fat cells, estradiol gets converted to estrone, the bad estrogen.
Why is it so important for women to watch their alcohol intake? What is it about that? Because when I was diagnosed, it was like, how many glasses of wine do you drink a week? And I'm thinking, well, not enough. I've got triplets, you know.
Exactly.
But that was one of the factors.
Absolutely, because it's actually 2 glasses of wine or more, or some kind of alcoholic beverage or more a day is actually very toxic for the body in general, not only in the liver level, but it causes more of that inflammatory state, again, once in the body, that can lead to different types of cancers. So alcohol in moderation is actually very good because it dilates blood vessels, which is good for the heart, but in excess it becomes inflammatory and bad for the heart as well as other cells in the body.
Well, and I know that we have a couple things that we want to bring to everybody's attention that are new ways for early detection. And boy, when I was diagnosed 3 years ago, I wish that these were around. So let's talk about I had stage 2 breast cancer 3 years ago, and my mother is a carrier. She's a survivor, and it runs on both sides of the family. So I just, back in my mind, I knew something might be happening. I just didn't know I was going to get it at 42.
Yeah, and it's interesting, as time is evolving, we're seeing more and more cancers in younger women between that magical age of 35 and 50.
That's scary.
And unfortunately, they're the more aggressive types of cancer usually. So it's really important that we detect them in earlier stages because, as you know, the earlier you catch the breast cancer, the more likely you can cure the cancer or have a great outcome.
Well, and with that, let's talk about the BT test because I wish this was around 3 years
Absolutely.
ago.
So the BT test has now been renamed. It's the breast test, but it's now Detect DX breast test. And it's really looking for those inflammation, those inflammatory markers in your bloodstream that signal the presence of a cancer cell growing, in particular in the breast for this test. So it's looking at IL-8, IL-12, which are inflammatory markers, and also growth factors, which signal that that tumor is growing and developing blood vessels.
And I was fortunate that I had a slow moving tumor because there are different forms of breast cancer. And as you know, I was walking around with this tumor inside my body for 5 years before it was detected. And this test is incredible. Where can people find this?
Well, you can order it. Luckily, here in Arizona, we're the only state that currently has it available.
Wow.
They're doing a nationwide push this year to put it in other states. But several physicians here locally can order the test for you. We obviously do it in our office, but you have to specifically request it. It's not very well known, but ironically, it should, I mean, it really should be, because mammography, as you know, takes a certain size of a lesion to pick it up. This can often pick it up before we even detect it on mammogram. And the interesting thing is sometimes women may signal positive on this test, but if we have good diet, anti-inflammatories working in our body, we may actually kill the cancer before it progresses further. And this test can signal that too.
Wouldn't that be incredible?
It's pretty awesome.
And you know, there's so many different questions about the age to get your first mammogram, and to know that you can go in and get this test before you even had a mammogram is just awesome.
Because our age requirements, usually we start mammograms at the age of 40 every other year, then yearly at 50. This blood test can start at 35 to 50, and actually we use it in women older than 50 if they have certain risk factors like fibrocystic breast disease, abnormal mammals in the past, actually being on hormone therapy, because it increases the density of the breast. And that's where the mammography is troublesome in young women. We have denser breasts, making it harder to detect those lesions underneath that density.
Wow, all the wonderful things that are taking place to help us beat breast cancer. Thank you so much for this
it's a
information,
pleasure.
Dr. DeRosa. Okay, and you can always go to Dr. DeRosa for any more questions. Her information's on the screen there, and she's just a phone call away. We'll be right back after this.